90% of the health information we create isn't used to improve health outcomes at scale and speed. If over 80% of patients fall through the cracks in some way, shape, or form, which means they're not getting the treatments, interventions, procedures that science says will improve their outcomes, right? Um, if we can enrich data and get the right data to the right person to create the right action, then we should be able to close those care gap loops. So, better data, better insights is the product. Now, the question comes down to what is that particular insight and how can that be actioned and productized? So, we're thinking a lot around clinical decision support co-pilots. You saw we just published actually yesterday and then a few weeks ago in JAMA, both with Sunnybrook Hospital and then yesterday with Princess Margaret Cancer, the idea of what was in JAMA was the idea of can we accelerate and automate cancer staging? We all know what happens and how important the right staging is to the trajectory of care and outcome. And it takes an incredible amount of time. And if we can automate and accelerate that to help clinicians, big outcome. Yesterday with Princess Margaret, can that same thing be able to identify patients with various radiation toxicities? Check. It's being presented at the American Society of Radiation Technology. Now, if you were to say, how quickly will those models be deployed and scaled within Canadian hospitals? That's where it falls down and we don't have an answer for, right? So you can have the product, but how do you get that product and the business model with the incentives you've talked about into the various users? And unfortunately, this is the grind. Like, one of the things, if we were to create a headline around population health, I think the stat is in our emergency departments across Canada, and we've all waited in line. We all know what's happening, despite the incredible hard work of clinicians, the heroic effort of nurses, and putting a lot of money into it. I think the stat is 30% of all emergency visit strokes, 40% of cardiovascular events, and 70% of non-traumatic amputations are a result of people just not managing their diabetes well, just not managing A1C, their A1C scores, right? Which is available and it's not in access. If we were to just pull on that thread and reduce what I just described, it would unlock a huge amount of healthcare capacity. So the question for the audience is like, why can't we do that? What's getting in the way of us scaling that? And there's a lot of great stakeholders working on it, and I'm optimistic that that particular problem will be solved, but it's not going to be solved next month, right? And it hasn't been solved yet, and we're in 2024.